All right, welcome to lesson 2 of module 4, and this is how to use dictation software. Here's what we'll cover in this lesson. First is how not to use dictation, when to type and when to talk. And then second is standardizing your dictation. This will fit in well with getting notes done quickly, even for patient boluses and everything else that we continue to be putting together for this course. So, using dictation software, let's talk about the don'ts. I would say don't freely speak about the patient without a goal. This can be more time consuming than typing with dot phrases. An example of this would be something such as the following. This patient presents today with chest pain. He reports it is very non-specific. However, it has sometimes radiated to his sternum and right shoulder. But this is not frequent. Occasionally, it radiates to his abdomen. He saw a cardiologist before. However, the cardiologist reported after a negative stress test that he can follow up in clinic. So you can see how this speaking freely without a goal and without direction may actually take you longer than what you could have typed out. So something more direct, having more directed dictation will be critical. For example, if a patient is presenting with chest pain, you want to follow the standardized HPI that we had created before. We just want to mimic exactly what we were typing because we do not want our brain to have to rethink what our systemization is. That systemization will become part of your automated process, and we need to solidify that. For example, we would say, patient presents with chest pain, X duration : 5 hours, course, constant, onset, sudden, character, dull, comma, non-radiating, comma, non-pleuritic, comma, no exacerbating factors, comma, no alleviating factors. We want to be concise and directed to the point where your brain memorizes that and goes through that without any thought and can do it even while somebody talks to you. Again, I will say, try not to dictate anything you have a dot phrase for. Dot phrases are faster than dictation. For example, if you have a dot phrase that says, no family history of heart disease or early cardiac death, and your dot phrase is dot family heart disease or dot fam heart, which is the one that I have included here in the resources section. Typing that out very quickly, the dot fam heart, is much quicker than dictating. Again, do not dictate your MDM if you have multiple dot phrases for it. If you can get through an MDM quickly, dot phrases are faster than dictation. It's just something to be aware of. How to use document dictation effectively. Again, utilize a standardized process. And this is just what we went through here. This is just an example that is written out of that. So here's what we've covered here. One is how not to use dictation, when to type, and when to talk. Again, I believe the most valuable part of dictation is utilizing it right in the HPI in a standardized fashion. After that, stick to your dot phrases. If you have those are going to be much better than your dictation. They're going to be faster, and they will populate faster as well. Very critical, and this goes along with everything we are doing in this course, is standardizing and systemizing your dictation so that you are not sometimes picking up the dictaphone, sometimes you're not. It's just standardized. You know when you're using it and when you're not using it.